Our next speaker will give us a 360-degree view on cancers in women. May I now invite Dr. Poovamma CU, Senior Consultant and Director, Breast Oncology, Cytecare Hospitals, Bengaluru. Ladies and gentlemen, let us give a big round of applause to Dr. Poovamma CU. Dr. Poovamma CU is a distinguished senior consultant and director specializing in breast oncology and surgery, Cytecare Cancer Hospital, Bengaluru. A rich academic background with prestigious fellowships from institutions in India and Germany is her significant feat. She is the first graduate to receive fellowships for breast diseases in India. A certified specialist in pain and palliation, Dr. Poovamma adopts a holistic approach to cancer treatment, emphasizing both physical and emotional well-being. As an oncologist, she is an expert in aesthetically conserving the breast for malignancies. She is also an educator and faculty for breast diseases and cancer at the Rajiv Gandhi University of Health Sciences. I wholeheartedly welcome you, Dr. Poovamma. Over to you.
Hi, good morning. So I think after a talk about music, food, I have a very serious topic to touch upon. To start with music, I think I love to play music in my OT. So that brings down the rate, keeps me calm, nothing affects us. And I think music is really a good way to bring down your heart rate and really help us with a lot of things. So coming to cancer, I think what we need to talk about today about cancer is first to remove the stigma that is attached with cancer. We all think, cancer means death. We treat patients differently. The way we behave with them, the way we talk to them, the questions we ask them is very different. A lot of my patients come back and tell me, doctor, it's easier to get through treatment, but it's difficult to deal with my neighbors, my family, my friends. The amount of questions I get, or I get out of my house, or I go for a walk, and people will ask me things like, are you fine? How are you today? And simple questions like that, how are you today, affects them. Because, they're made to think that they're not well, they're going to fall sick. Sometimes they tell me things like, oh, it's been 2 years already? You're still okay? I think so we need to remove the stigma that is attached to cancer. Many times patients will come and tell me, doctor, should I worry? So my answer to that is, what are you going to achieve by worrying? Can we achieve anything by worrying? Is it going to maybe say prevent a relapse? Nope. And I think maybe not worrying will help us to prevent a relapse, right? Because your stress levels come down, your body releases good hormones, endorphins, you feel happy, and all the stress-related hormones which can further cause a relapse comes down. According to the American Society of Oncology, they say nearly 30 to 40% of cancers are actually related to our lifestyle. Lifestyle meaning what you eat, what you drink, what you do, what time you sleep, how do you deal with stress, and that's the ground reality. 30 to 40% of cancers are something that is related to our lifestyle. So what is cancer? So our bodies are this huge, wonderful mechanism of how they can, repair itself. And usually it's seen that when something goes wrong in the body will give information back to the individual cell saying, you are not fine, you're unhealthy, you die. But in cancer, what happens, these mutated cells continue to grow, divide, and spread. That's what cancer is. And the number of cancers are rapidly increasing world over. India is catching up. We don't know the true numbers because I think there's a lot of underreporting of cancers in India, especially in the rural places. And typically, you would hear someone tell you, I knew this person, they were absolutely fine, and suddenly, within 1 month, something happened, they deteriorated, they had breathing problems, they had jaundice, something happened, and they died. And that's typical of like a stage 4 cancer, which, the patient is in their end phase, the whole body is being eaten up by tumor, and that's how they meet their death. What are the most common cancers in India for women? Breast, cervix, yes, ovarian, GI. So all lifestyle related cancers, okay? And I think what we really need to know today is how do these cancers come out? What are the symptoms these cancers have? Because people have this myth, I think we watch too much of the Bollywood and the Hollywood movies, and we think cancer has to come in a huge bang. You have to be unwell, you have to have, loss of weight, loss of appetite, you have to, become slimmer without, trying to lose weight, you have to look cachectic, and only then cancer is there. Most cancers are very, very, very silent, and all those typical symptoms of, coughing out blood, or, looking really unwell are typically maybe in an end stage cancer, and you can be completely normal, walking around, doing everything well, and still you could have cancer. Many a times patients will come with these huge bunch of reports, doctor, I go for a yearly checkup. I've done my reports just, 3 months back and everything was normal, but now you tell me I have a stage 3 cancer or a stage 4 cancer. So how is that? So some of the routine blood tests we do are, to look at how our blood works are. Maybe some blood cancers can be picked up with that. Or maybe, the renal functions will tell us how well our kidneys are functioning, or how well our liver is functioning, or what is your cholesterol levels. But most of these tests are not going to tell us whether we have a cancer harboring. So sometimes maybe your liver functions might be completely abnormal, and that could tell us, yes, there might be something more lingering over there. The liver is failing. What is the reason for the liver to fail? But otherwise, you could have a stage 4 cancer, walk around and be absolutely normal. I had this lady recently who came in, some time back actually, the post-COVID, who came and told me, advocate by profession, having a good practice. And she said, doctor, I noticed this lump in my breast, but it was absolutely painless, not troubling me one bit. And this is something I hear every day, okay? I have noticed something, but not troubling me. Not troubling me means I don't get to the doctor. So, I had a tough time during COVID. My dad passed away. My mom, had to settle her down. And now everything's settled, doctor. And I think, maybe it's time for me to get this evaluated, because this lump is persisting and it's increasing. And for her sad thing, she had a stage 4 breast cancer, okay? And that's the true thing about cancer, is it is silent for a very long time. And I think typically we women kind of tend to neglect our health. And I really liked what the last speaker said, without looking after our own health, we can't look after the people around us. And I think women are the backbone of their families. And I've seen how the family crumbles when the woman is unwell. So please put your health. It's the most important thing at the forefront. If you are not well, your family is going to be unwell. If you don't take that step today and say, like I had this lady who came in one day and told me she was having a stage 3 cancer. And I said, listen, you need to get this treated. We need to treat you. We need to start treatment. She says, doctor, my son is in the 12th standard, and I can't go for treatment for the next 3 months. So can I maybe come back after 6 months for treatment? And whatever kind of counseling I tried doing, it just didn't work. In the end, I had to tell her, do you want to be there to see him when he graduates and go to college? Or do you want to be there now and then give him a really sick mother 1 year later? But that's the truth about cancer. It's the treatment at the right time which is what is important. So coming to some of the common cancers in women, cervix, endometrium. Endometrium is the lining of the uterus, ovarian cancers. So what is cervical cancer? Can we prevent cervical cancers? Yes, how? It's right there. Yes, HPV vaccine. I think we've heard a lot about it recently. And yes, HPV vaccines go a long way in preventing cervical cancers. It's not just for cervical cancers. The human papillomavirus also causes, any ideas? It causes head and neck cancers. It causes penile cancers. It causes anal cancers. So it's not just for women. It's also for the boys out there, okay? So typically we give these vaccine. In some countries, it's mandatory for boys also. If you can afford it, please give it to your sons also and not just your daughters. It goes a long way in preventing cancers which are related to a viral infection. Typically any girl above the age of 9, between the age of 9 and 25 is the ideal age to receive this vaccine. What increases risk for cervical cancer? Again, right there. I don't want to only talk. I would like to have some interaction from the audience. Poor personal hygiene, multiple sexual partners, a sexual partner with, risky behavior, all of that increases risk for cervical cancer. So typically they would complain of maybe some kind of persistent discharge, foul-smelling discharge, postmenopausal bleed, post-coital or post-sex bleed. That's what a cervical cancer can come with. But this is one of the cancers which can be picked up really early, even before a cancer sets in. So there's a time period where there's some abnormality in the cervix before it turns into a full-fledged cancer. Okay, so we call it as carcinoma in situ, when it's not yet turning into cancer, not yet cancer, but will turn into cancer. And this can be detected by regular pap tests, pap smears. So what can we do to prevent cancers or to pick up cancers early is something called a screening, meaning to say we look for cancers actively before you have symptoms. And pap smear is one of those few tests which can actually be done and tell you, yes, everything is okay, everything is normal, or there's some change there. If we leave it untreated, this is going to progress to cancer. So typically cervical cancers in the age group about 40 to 75, very common in India. It's become the second most common cancer in India. It's still the most common cancer in the rural population, but breast has overtaken that in the urban location. So HPV can prevent nearly 19, and most of it is caused by HPV virus, and with the vaccine you get more than 90% safety from that. So again, the risk factors are early onset of sexual activity, multiple partners, immunosuppression, multiple early pregnancies, and that's why we recommend that this vaccine is given to girls before the onset of sexual activity. After that, there is still some benefit, but the efficacy kind of comes down a little bit. And we advocate that pap smears be done once in every 2 years after the onset of sexual activity. And if you've had more than 3 normal pap smears, you can push the timeline to once in 5 years. You can pick up cancers, or even not cancers, you can pick up things even before it's going to turn into a cancer. So again, HPV vaccine, I think I've already spoken about it. Now, the government of India is coming out with their own vaccine, which is much more economical. So please talk to your doctors about getting this vaccine for your children. And next is endometrial cancers. What is endometrial cancer? Any idea what is the endometrium? Yes, the lining of the uterus. Again, a cancer which is lifestyle related. Obesity is a huge risk factor. Nulliparity, not having children, again, is a huge risk factor. PCOS, I think now every other person has a PCOS, again increases risk for endometrial cancers. Something which can protect you against endometrial cancers are being on OC pills, that's oral contraceptive pills. Increased physical activity reduces the risk. Weight reduction plays a huge role in reducing the risk for endometrial cancers. And I think, again, this weight is a huge thing that we're talking about. Obesity is becoming very, very endemic in our society. We are seeing a lot of young children who are obese all the time on social media, or with their laptops, their tablets, their mobiles. Physical activity has come down, and I think it's time for us to, as women, to take the onus on ourselves and make sure our children are out there getting their physical activity, getting adequate exercise. I think that's very important. Again, an endometrial cancer can be picked up early by doing routine ultrasound examinations once a year, typically after the age of 40. The symptoms are just heavy bleeding, irregular bleeding. Again, you can just have postmenopausal bleeding again, which could tell us that there's a cancer lurking over there. Again, postmenopausal excessive bleeding. Ovarian cancers is another common cancer for women. Again, age group 50 to 75, but we are seeing a lot of youngsters, 20s, early 20s, 30s. Very common if you have somebody with ovarian cancer and breast cancer within the family, please think of hereditary breast cancers or hereditary variant of breast cancer. Another common thing always here in the clinic is that, doctor, I'm the first person in my family here who has cancer. But that's normal. How often do you see cancers in the family? So hardly 5 to 10% of cancers are genetic or hereditary. 90 to 95% of cancers, we have absolutely no history of cancer in the family. So please don't be complacent thinking, oh, my family is all fine. There's nobody in my family who has cancer. So I obviously can't get cancer. That's a complete myth. Cancers are very few percentage of cancers are hereditary. But if you have somebody in the family with ovarian cancer, somebody else with breast cancer, bilateral breast cancer, male breast cancer, that could be a hereditary breast cancer. Please talk to your doctor. There are a lot of things we can do to reduce your risk. So infertility and endometriosis, again, increased risk for ovarian cancers. Again, ovarian cancers are very, very, very silent cancer. The ovaries are hardly like lemon-sized, deep inside our abdomen, in our tummies, and symptoms usually arise late. When the tumor becomes quite big, or the symptoms are very vague. It could be just a subtle tummy pain, a subtle pain which is not going away, a little bit of heaviness in the abdomen, sometimes just having urinary problems, frequent urination could be a symptom. Sometimes you could have difficulty in eating because, it's pressing on your intestine. You might be losing weight. So those are the typical symptoms for ovarian cancer. So what can protect you for ovarian cancers? Pregnancy is protective. Again, OC pills are protective. Breastfeeding is protective. Tying of the tubes are protective against ovarian cancer. We can't screen for ovarian cancers. Like how I told you about PAP for cervical cancers, there's no screening test for ovarian cancer, meaning to say I can't do this test and tell you you're free. Like say PAP, I told you can do it once in 2 years, and typically if there's something abnormal, we would pick it up in between those 2 years. But with ovarian, I could do a scan today and say, yes, your ovaries look completely normal, and 3 months or 4 months down the line, you could develop a new ovarian cancer. So ovarian cancers is something we can't actively look for and say, okay, your ovaries are normal. I give you a guarantee, surety that nothing will happen to you with regard to the ovaries later on. So keep a lookout. If you have any higher family history of ovarian cancers, please get your doctor. So that's just the screening tools for those three kind of cancers. Okay, so a pap smear or a HPV DNA testing, an ultrasound examination after the age of 40 can, help to pick up these cancers earlier. Now coming to breast, what causes breast cancer? Pardon? Okay. I wouldn't say not feeding the child, but I would say feeding a child gives you some amount of protection. Okay? Being a woman increases your risk for breast cancer. Okay? I won't even say age is a criteria, because I have women who are in their 20s, I have women in their 30s, I have women in their 70s, I have women in their 80s. Okay? So I can't even say, okay, as you age, you increase, the risk of breast cancer goes up. And this is completely different from breast cancers in the West. Typically in the West, they will say, cancers occur in women above 50 years of age. But if you look down at our own statistics from the ICMR, nearly 48% of breast cancers occur in women less than 50 years of age. So if I say, above 50, be careful, 50% of breast cancers are going to be neglected. Okay? So that's what is important. Again, breast cancers, excellent prognosis. For most cancers, we have excellent prognosis, meaning to say they do well in the long term when it's picked up early. But in India, again, lack of awareness, lack of time, lack of putting our health first. A lot of women diagnosed late. We say that for every 2 people diagnosed with breast cancer, 1 of them die, and that's only because it's diagnosed late. Again, like I said, what increases risk for breast cancer? Any women As you age, you don't have to have a family history. Only about 5 to 10% of breast cancers are genetic. Again, this is again a lifestyle disorder. Obesity, lack of physical activity, increasing, we've seen that, right? We've seen our grandparents. What was the age at when the period started for your grandmother? 15 years? 16 years? For your mother? At what age? So it came down to 12, 13, 14. And what's the age at which girls mature today? 9, 8, yes? So as the age for maturity decreases, they increase risk for they're exposed to hormones for a longer time, and that's going to increase their risk of developing breast cancer. So we are looking at breast cancer rates dramatically going up because age at which the periods are starting is dramatically falling down. So the younger you are when you mature, the older you are when you attain menopause, again increases risk for breast cancer because you're exposed to hormones. Another thing is if you're postmenopausal and if you're on hormone replacement therapy, that also increases risk. Not having children actually increases risk for breast cancer. Late pregnancies above the age of 35, again, increase risk for breast cancers. I have a lot of young mothers who have breast cancer. 6 months after a pregnancy, they're breastfeeding. Just operated one like that just about 2 days back. 32-year-old, 6-month-old child, breast cancer. Again, especially in this set of women, there's a lot of late diagnosis because nobody thinks of cancer. When you're pregnant, you have just had a baby, everything is so rosy, pleasant, and you already have so many changes happening in the breast, so you never think this is a cancer. And sometimes you need to have a high degree of suspicion to detect these at the right time and not allow them to go from a stage 1, stage 2 to a advanced stage 3, stage 4. So again, alcohol consumption increases, smoking increases. It's sad that but we women definitely don't deal with alcohol the way men deal with it. Our bodies handle it differently. That's how God has made us. That's for the sad thing. But yes, so one peg for women would be equal to like a man having 3 or 4 pegs. That's how different alcohol is dealt by women. So the younger you are when you have your first child, the lesser chance of developing breast cancer. For every year that you feed, your risk for breast cancer decreases. So again, one particular thing I want you to take back home about breast cancer is, again, a very, very silent cancer. The most often complaint is just a lump in the breast or some kind of a thickening in the breast, most often painless, okay? So pain is what brings someone to the doctor, but most of the problems I've been talking about, I have not mentioned pain as a symptom, if you've realized. So it's not painful. Cancers early are not painful, and that's why there's a delay in diagnosis, okay? So any kind of a lump in the breast, any kind of a thickening in the breast, any kind of a change in the breast which is persisting, you could just say that, the whole breast feels big, the whole breast feels small, the nipple is just being pulled inwards, pulled towards one side, you have nipple discharge, which could be just bloody or pinkish, again, could be a symptom for breast cancer. So if I have 100 breast cancer patients, maybe 2 or 3 would complain of pain. And if I have 100 patients with breast pain, I have a lot more difficult time convincing these women that they're fine. I think the consultation is much longer. They're saying, you're fine, go home, you're fine, compared to selling somebody who has a cancer. And then I tell them you have cancer and they look at me like, I feel absolutely fine. I don't have any pain at all. And you're telling me I have cancer? But that's the ground reality. So we use lemons to say for the symptoms of breast cancer, think of a normal lemon, and any kind of an abnormality on that is a cancer. So breast cancer is again another cancer which we can screen for, meaning to say we look for the cancer when you are normal by doing routine clinical breast examinations and mammogram. A mammogram, when we do this at regular intervals, we can pick up tumors which are very, very small, even 5 millimeter tumors, 6 millimeters, tumors less than 1 centimeter. And a stage 1 breast cancer has a cure rate of 96%. And this will fall to 75, 80 for stage 3, and a dramatic fall to 20 for a stage 4 breast cancer. So for all cancers, I think at what age we pick it up is very important. For breast, we say all women above the age of 40, make time, go for a mammogram at least once a year. Again, if you go to Google doctor will tell you do a mammogram once a year, once in 2 years, once in 3 years. How does that, how do we get so much of discrepancy with those rates? So many a times screening in the Western world is driven by the government, okay? So the government will decide, okay, if I do this once a year, what is it going to cost me? How many lives am I going to save? If I do it once in 3 years, how many lives will I save? So it's kind of like an economic exercise. But what I would say is, try to do it at least once in a year to at least once in 2 years, and be breast aware, meaning to say be aware of what your body is telling you, be aware of what your breast feels like, looks like, anything different, abnormal, go get it evaluated. And the routine thing we do is a digital mammogram, and I think a lot of people would have read about breast density and different things like that. So this is the upper pictures of a breast who's much older. So you see a black and white image, and the white is the breast tissue, okay? The image below is of a woman who's much younger, so the entire breast is more of breast tissue and less fatty tissue. And you can see a cancer appears white, okay? So white on white, and that's why we say maybe mammograms after the age of 40, 50, and we use, with the mammogram, we do an ultrasound also to pick up these tumors earlier. Now coming to some of the other cancers in women, yes, oral cancers, again, some another cancer which can occur in women. It's not just in men. Smoking, tobacco, alcohol, it's again HPV, poor nutrition, chronic irritation because of, say, a malformed tooth or a sharp tooth can cause constant a movement within the oral cavity and cause cancers. Okay, so it's not just men who can develop. If you notice any change in the oral cavity, any kind of a white plaque, red plaque, any kind of a growth, any kind of an ulcer, please get it evaluated. Sometimes all you might notice is just a swelling in the region of the neck, which is maybe an enlarged lymph node. Again, when you talk about GI tumors, we have a whole range of cancers starting from the oral, from the feeding the tube, the esophagus, to stomach, the pancreas, the liver, pancreatic, colorectal. Again, the risk factors are vague: smoking, alcohol, increasing age, high animal fat diets, food which is preserved for a long time, lot of salts being used for preservative, a lot of these preserved food, off-the-shelf food, right? Again, obesity, you can see that obesity is something which is coming literally for every type of cancer. So coming to food, what I want to stress is, I think having a colorful plate, having a rainbow on your plate is helpful. And with India, we have options of so many things. Eat local, eat what's in season. Try to have a lot of colors on your plate, the pinks, the purples, the greens, the blues, and cut down on the white on the plate, and that will help you. Again, gastrointestinal cancer symptoms are really vague, just a persistent pain, a persistent discomfort, constipation, lose motion, some kind of bleeding which you notice, sudden loss of appetite, persistent nausea or vomiting sensation, you're losing weight without an intention to lose weight. And this is typically what you would see in a Bollywood movie or a Hollywood movie. Somebody is just losing weight or losing appetite. That's more for GI tumors and not for other tumors. Okay. Again, lung cancer, it's not just males. In lung cancers, we have different varieties, subtypes, and one of the subtypes, non-smokers can get lung cancer. It's called as an adenocarcinoma. Again, high degree of suspicion required, just a persistent, a cough, a dry cough, persistent dryness, sore throat, please get it evaluated. Again, this could be something, a typical symptom of coughing up blood, could be a sign for lung cancers, or just persistent evening rise of temperatures, fatigue, breathless could be a symptom for breast cancer. So, just one. This is just a template. Any kind of a change in the body which is persisting, like a change in your bowel or bladder habits, a sore which doesn't heal, unusual bleeding, discharge, any kind of a thickening or a lump anywhere in the body, indigestion, difficulty in swallowing, any mole which starts to look different, any cough or hoarseness of voice could all be symptoms telling us that there's something there. Now, coming to the treatment of cancers, usually there's a component of surgery, chemotherapy, radiation therapy, hormone therapy, and every cancer is dealt in a different way. Within a particular organ, again, the treatment can vary depending on the stage of the cancer, depending on the molecular subtype of cancer. So what we say is today, cancer treatment is not one treatment or one blanket which fits everybody. The treatment is individualized or tailorized to the kind of cancer that person has. But what can we do to prevent cancers? Yes, the typical, I think the sad thing is we go to the movies and we have this really horrible looking, uninteresting, unexciting person telling us don't smoke, don't drink, and then we have all the cons who come and tell us, make the smoking and the alcohol look very fashionable. I think that's a sad thing. We have to pull up these people to have more, authentic marketing, I think, and branding. So alcohol, tobacco, again, increase risk for a large number of cancers. Protect yourself, HPV, hepatitis B vaccine. Awareness, I think, is what is the most important thing, and also taking onus for our own health and not delaying to getting to the doctor. Get it evaluated. It's always better to evaluate something and then say, yes, I'm fine, than not evaluate and then have a bad cancer. Like I had this girl who's 33, kept telling her mom, I feel something different in my breast. I feel something different in my breast. And the mom kept saying, oh, I'm sure it's just related to your cycles. Don't worry. And, it's time for you to get married and, busy looking at different horoscopes or whatever it is, trying to find a suitable suitor. And 1 month later, she says, no, I still feel this something different. And again, the mother tells, this is what the girl's telling me. But the mother told her, no, this is related to your cycles. Don't worry. After about 3 months, she decided, okay, let me get it evaluated. Let me just go get it checked because, it's persisting. And then she landed up with me. And then when we examined her, she had a stage 3 breast cancer. She was one of those who had a hereditary type of breast cancer coming from her father's side. And because her father is absolutely normal and parents have had a love marriage, so they don't have much connection, with the extended family, the family history is completely gone out of the head. And she's fine. But what I'm trying to say is, you can have young people developing cancer and it's becoming a norm today. So don't falsely reassure someone saying you're fine. It's better to say, go get yourself tested, have a normal report, breathe easy, than disregard it. If something is abnormal, it's not going to go away. It's not going to go away. It's going to persist and it's going to get worse. Like I had this other lady who came in. Her sister had breast cancer. And she said, she was 70. And she said, doctor, I'm just here because, my sister had breast cancer. I'm absolutely fine. And I said, okay, good. I'm sure you'll be fine. But we did a mammogram for her and she had a stage 1 breast cancer. And she's absolutely fine today. And this is, I think, 4 or 5 years later. And I'm just saying it's so important that we pick up these cancers early because, yes, there might be a little difficult period, but after that, they are fine. Alcohol again, a lot of different types of cancers. It's becoming very fashionable for us to drink, I think, these days. But that, again, goes up. Again, obesity, to reiterate, obesity increases a risk for a lot of different types of cancers. In the West, it is said that 1 in every 2 people will develop any type of cancer. 1 in every 2. And that's the rate we are looking at. And I think it's high time in India we stop aping the West, go back to our old ways of living, of how our grandparents lived. Eat healthy, eat local, eat nutritious food, not packaged preservative-driven processed foods, and emphasize on physical activity, emphasize on physical activity. Even just few years back, I remember one day I was telling somebody, I just can't make time to exercise. Who has the time? And that person looked around and backed and looked at me and told me, don't you make time to have 3 meals a day? And I was like, okay, yeah, I do make that time. I think so. It's all just the perspective that we have, you know, especially women. The first thing when I tell my patients, please exercise, is like, doctor, pilsilva, maddilva, ಏನ್ ಮಾಡಿದ್ರು ಕಮ್ಮಿ ಆಗಲ್ಲ ಮನೇಲಿ ಕೆಲಸ ಮಾಡಿದ್ದು ಸಾಕಾಗತ್ತೆ. But what work are you doing? You're standing, you're cooking, or you're doing work which is just static work. I say, okay, you want to do housework? Clean, swab, do something more physical. You know, the work you're giving, you're outsourcing to your maid is making her healthy, but the work you're taking on is absolutely not helping you. And maybe it's time that, we make that, cut out that 30 minutes a day for ourselves, for our health. Just to touch on PCOS, because a lot of time women ask me, Doctor, PCOS, does it increase my risk for anything? And what is the reason for PCOS? Slightly genetic, but again, very common in young girls, increases risk for diabetes mellitus, increases risk for endometrial cancer. Again, a lot of it environmentally driven, obesity, lifestyle, stress, insulin resistance. Again, like I said, it increases risk for diabetes, and diabetes itself is a risk factor for cancer, okay? Diabetes itself is a risk factor for cancer, increases endometrial cancers. So a healthy diet, regular exercise still holds good. An apple a day keeps the doctor away, still holds good today. So these are things what we can do. Manage stress better, sleep better. Nobody talks about sleep. Many times we talk about food, exercise, but we lose out on stress and sleep. And I think stress is where music comes in. Find some hobby. Meet your girlfriends. For women especially, girlfriends are very important, not the boyfriends, okay? It really helps you to detoxify and get stress-free. So that's my take home.
Thank you, Dr. Poovamma. It's really informative to know that 30 to 40% of cancers are related to lifestyle. So let's remember to be educated, and let's not pick and choose which health concerns we, look at because they are causing immediate issues. Let's focus on all of it. Let's focus on keeping ourselves healthy, and let's make time for ourselves. The floor is now open for questions. Thank you.
Yeah, we can have questions.
Thank you, madam, for this informative session. Ma'am, I would want to know that if there are any screenings which can be done at home to predict this breast cancer.
Okay, so what we talk about is being breast aware or self-breast awareness. So why I didn't talk about it much is because there's been a lot of talk about, using self-breast examination as a tool for screening for breast cancer. And studies have been done from 70s, 80s, 90s, and it has been proved that we women are very inconsistent. We don't do it well. But yet, I'm going to tell you. So what we say is be aware of what your breasts look and feel like. And ideally, every month after your period is over, look at yourself under the mirror, lie down, feel the breast. If this is the breast, with the flat surface of your fingers, gently touch down and feel. Are you feeling any kind of knots, any kind of a lump, any kind of area which feels different? Is there any spontaneous nipple discharge? Is there any lumps under the breast? Do that once a month. Stand in front of the mirror. Do the nipples look normal? Is it being pulled towards one side? Is it being pulled inwards? Or does the skin of the breast look like that of an orange? Or just as one breast looks different from the other? It could be much bigger or maybe much smaller. And yes, being breast aware could bring you to the doctor much earlier. And that's something that you can do at home.
Just one more question. Ma'am, is there anything that we need to follow with the food that we take? Like there are a lot of prejudice nowadays about non-vegetarian food, milk, dairy products. So does that also affect our health in a great way?
Yes, what we eat definitely, I think, goes a long way to see what happens in the body. Okay, so I'm not saying that all non-vegetarian food is bad, but processed meat is been proven to be carcinogenic, meaning cancer-causing. Processed meat, you have your ham, your bacon, your sausages, whatever, anything going industrialized, processed, unhealthy, proven to be cancerous. But other than that, I would say anything and everything in moderation is fine. Like I was saying, have a rainbow on your plate. The more colorful food you eat, the more variety of fruits, vegetables that you eat is going to give you a lot of health benefits. But the true sad status is, I think, is whatever we try to do, the practices that are there out in the ground is that our food, like grapes, okay, simple grapes, huge antioxidant laden. But it comes to us with a residue of pesticide around it. They say they can't grow grapes without literally dipping every bunch in pesticide. Okay, and that residue that you see, that grayish thing that you see, right? And this is, I'm not talking about grapes and saying, oh, please eat grapes from, the Australian globe, which is 400 or 500 kgs is better than the Indian. No, that also comes with a set of pesticide. So the sad practice is that farming has deteriorated so much that there is pesticides in everything that we eat. Our groundwater is contaminated. I mean, I have patients who come from farming backgrounds who don't know what a McDonald's or a KFC is, who's never eaten a pizza in their life, who's never eaten lunch for dinner. And I look at them and I wonder why. And I think it's just the pesticides, the chemicals that we are exposed to. So yes, we can do a lot of changes, but that's the ground reality.
Thank you, ma'am.
Thanks for that wonderful insight, ma'am. Yeah.
Excuse me.
Yeah.
I have a question, sorry. Hello. Like, I want to know, even if the uterus is removed, are there still chances of getting ovary cancer or connected to that?
Yes, if you have your uterus removed and you have your ovaries inside, you can still develop an ovarian cancer.
Okay.
There is no rule that, you remove the uterus so the ovaries are safe. No. Many a times we've seen that, somebody's gone through a hysterectomy and they had one problem with one ovary, so they've removed that one ovary, but other ovary was normal and that's been retained back, and few years later they do come back with the ovarian cancer.
Thank you.
Yeah, thank you, ma'am. Yeah, someone at the back.
I think let her ask.
Hello, ma'am. My name is Nishka and I'm a teacher by profession. First of all, I should thank you for such an informative session for us. Actually, my mom, she was being diagnosed as a breast cancer in a first stage, and she had a lump in her left breast. So she's been operated and she's fine now. And it was, thank God, it was not been, spreaded in other parts of the body. So, but then still doctor suggested her for chemotherapy. But she was like, it's a no for her, it's a big no for her. And she did not go for chemo, but she's super fine now. So I just want to ask you, is there a relaxing way for us, saying that, okay, she's fine, we can be like this, or else should we have to convince her for chemo, or what is the next process that we have to do it, ma'am?
Yeah.
When was she operated?
Last year, ma'am.
Okay, if it's been last year, we can't do anything now. Okay, it's too late to give chemotherapy. Right now, I would just say keep her on follow-up and hopefully nothing happens. So it's not that all breast cancers need chemotherapy. It depends on the stage of the cancer. It depends on the subtype of cancer. And by giving chemotherapy doesn't mean it gives you 100% cure. Okay, chemo adds to the cure rates. Depending on the type of cancer, it might give you a 4% benefit, it might give you a 6% benefit. For some subtypes of cancer, depending on the stage, it can give you up to 25% of benefit. So it's not that chemotherapy means 100%, cancer is not going to come back, or I have not taken chemo, so 100% cancer will come back. But 1 year after treatment, we're not going to give a chemo right now. Okay,
And
so
more.
we'll keep her on follow-up.
We can have that follow-up question with ma'am later.
Yeah, sure, sir. Thank you.
Thank you so much, ma'am. Thank you so much.
Thank you so much. I request Mr. Ashish Singh, Chief Marketing Officer, Happiest Health, to hand over a token of gratitude to Dr. Poovamma. I also request Arjun PR,